Okay, everyone, good afternoon. Today is the meeting of the strategy. Sorry, I'm losing the plot. Today's the Health Scrutiny Board. I'm Andrew Scopes, I'm the chair of the board. Thank you very much for coming today. As you know, this meeting is a public meeting, so there's people in attendance in the public gallery, but also it's broad live on YouTube, and you can watch it back later as well if you wish to. If you're watching online, you can find the papers that we refer to just by typing into a search engine Leeds Health Scrutiny, and usually it's the first item when I do that. As I said, this is the Adults Health and Active Lifestyle Scrutiny Board. I'm Andrew Scopes, I'm a councillor for Beeston Holbeck and the chair of this meeting. We're going to go round and introduce members of the committee. We'll go through the first few items, and then as we get into the further items, I'll ask other people to introduce themselves. Thank you. So move it to my left, if that's okay.
Good afternoon and Happy New Year to everybody. I'm Councillor Kevin Ritchie Bramley in Stanley Ward.
Good afternoon, Happy New Year. It's Councillor Haley France Mear for Moortown and Meanwood.
Good afternoon, Happy New Year everyone. Councillor Andy Ronchy from Kirkstall Ward.
Good afternoon and Happy New Year. Councillor Bromley for Horsforth and Rawdon.
Good afternoon and Happy New Year to you all. I'm Councillor Taylor and I represent Chapel Allerton Ward.
Good afternoon, Councillor James Gibson and I represent Crossgates and Wimmer Ward.
Hi, Happy New Year from me too. I'm Jonathan Phillips and I'm co-chair of Health Watch Leeds.
Good afternoon, Councillor Conrad Hartbrook, Rothwell Ward.
Good afternoon and Happy New Year. Councillor David Blackburn, Farnley and Wortley Ward.
Good afternoon, Councillor Winkage representing Morley South.
Good afternoon, Councillor Lynn Buckley representing Woodley Ward.
Good afternoon everybody, I'm Councillor Caroline Anderson, I represent Adlon Wharfdale Ward.
Good afternoon, I'm Angela Brogden and I'm the Principal Scrutiny Advisor to this board.
Super, thank you very much, and just to say welcome to Councillor Blackburn. It's your first formal meeting. I know you've come to one of our working groups, and obviously Jonathan is a co-opted member on the committee whilst not an elected member on the council. Okay, so I'm just going to move on to the first sort of procedural items and ask Angela to run through those for us. Thank you.
Thank you, Chair. So firstly, under item 1, just to confirm there are no appeals against the refusal of inspection of documents. Under item 2, there are also no items for exclusion. In relation to item 3, there are no late items. And under item 4, please may I ask at this point if board members have any declarations of interest? Councillor Ritchie.
Thank you. Just to declare, it's a non-pecuniary interest, but they are mentioned in the papers. I'm a patron of FAB, the charity FAB, and there are other third sector partners which may be affected. I just referred to my register of interests. They're all non-pecuniary interests. Some of the boards that I'm on that may be affected by some of these proposals that aren't specifically named in here.
Thank you, Councillor Ritchie. Moving on to item 5 then, Chair, we have no apologies from board members, but we have received apologies from Victoria Eaton, who's Director of Public Health. Thank you.
Super, thank you very much. Okay, moving on to the minutes. Firstly, are there any points of accuracy on the minutes of the last meeting, which was on the 12th of November? I can't see anyone indicating, so I'll take those as a true record. Thank you very much. And then any matters arising? I'll start with Angela.
Only to say, Chair, and obviously we can pick this up under the work programme, the minutes reflect the working group that was held around neurodiversity of children and adults, and a summary note will now be brought to the February meeting of this board. Thank you.
Thank you very much. Any matters arising from any members of the board? No? Okay, super, thank you very much. So we'll move on to the first substantive item, if that's okay. which is the Leeds Safeguarding Adults Board, and the progress report, which is in your paper, should be on page, I think it's on page 15 onwards in your packs. What we'll do is we'll go around the guests, introduce yourself, and then I think Richard will probably want to say a few words. So thank you very much. Start with Councillor Venner, if that's okay.
Hi everyone, sorry, I'm Councillor Fiona Benner, I'm the Cabinet Member for Equality, Health and Wellbeing.
Hi everybody, I'm Councillor Salma Arif, I'm the Exec Member for Adult Social Care, Active Lifestyles and Culture.
Hi Chair, I'm Jane Wallen, I'm the Chief Officer for Active Leeds Operations and Culture in City Development.
Good afternoon, I'm Shona McFarlane, I'm the Deputy Director for Adults and Health.
Good afternoon, I'm Caroline Barrier, I'm the Director for Adults and Health.
Hi, I'm Rob Wood, Head of Intelligence and Performance for Adults and Health.
Hi, I'm Richard Jones, I'm the Independent Chair of Leeds Safeguarding Adults Board.
Thank you very much. So over to you, Richard, to introduce the report. You can assume that we've read the paper, but if there's anything in particular you want to draw out, please do. Thank you.
Thank you very much, Chair, and thank you for the opportunity to give you an update on where we are across the city in terms of the work of the Safeguarding Adults Board. Just thought it was important to kind of just paint a differentiation between the role of the board and that of its partners. So we're an independent statutory board. We work at a strategic level. Our job is to ensure that there are effective working relationships across the city in relation to supporting adults who are at risk of abuse or neglect. Our job's to ensure that there's a policy framework, that there are clear procedures that people work to, that we learn from what goes right and we learn from what doesn't go well to affect frontline practice and outcomes for citizens. And we are also about ensuring we look out beyond Leeds to best practice nationally and to ensure that we get assurance that partners are working with effective arrangements to protect adults. The statutory agencies, the partners that make up the board, are the people who provide the safeguarding services and the responses to people today and every day here in the city. I'm an independent chair. I've got a background in social care in the NHS and the independent sector, and my role really is to, without any particular kind of alliance to any organisation, to work on behalf of the citizens of Leeds to ensure that organisations are nudged, pushed, encouraged, supported to deliver the programmes of policy that we see as priorities. So that's my job. We have a vision in Leeds, which is that Leeds is a safe place for everyone. And we have 4 ambitions, which are in the paper, so I'm not going to say too much about those. We are citizen-led, so we've done a lot of work on understanding what good looks like from a citizen perspective. We're wanting to raise awareness across all communities about safeguarding, and we've done a lot of work this year in conjunction with the Children's Partnership around safeguarding faith communities, and we're doing work that's been initiated by the Adults Board but now will be supported by the Children's Partnership and Safer Leeds, looking at safeguarding awareness in ethnically diverse communities. I'm very excited about that piece of work, and Caroline to my right is going to act as our champion in that area. We are also keen to ensure that we develop citywide approaches to safeguarding that links to work, for instance, of the Domestic Abuse Partnership. We've got a major focus around self-neglect. Big conference coming up next week with 160 practitioners meeting with national experts to think about how we enhance our work in that area. We're doing work with the Social Care Institute for Excellence, thinking about the barriers and those things that need to be put in place to create effective working relationships across agencies, and a huge amount of work done too with colleagues, by colleagues around mental capacity. And finally, we have an ambition around learning from experience, from ensuring that there are good quality assurance systems in place. And one of our statutory responsibilities is to undertake safeguarding adult reviews. And in the last year, we have completed one in relation to a Miss I, who was a young woman with learning disabilities who was subject to sexual assault. And there's been a lot of learning in that case that we're now getting assurance on, particularly in relation to information sharing between police and adults and health, and how it is that we engage and work with families who are subject to those kinds of investigations. And the two carers for Miss I, who were shared lives carers, have undertaken a huge range of training with frontline staff and frontline police officers, and that's been hugely influential. I don't want to say too much more other than to flag the fact that I think we're in a good place as a board. We've got mature relationships, there's good shared leadership, lots of champions working on different areas, and it's an opportunity for me finally just to thank the colleagues who I work with in the Safeguarding Board's support unit, because they are critical to the work we do, but also and primarily to frontline staff, whether they be in health, social care, and the voluntary sector, whatever setting they're in, because along with the report you'll see there's some statistics, and what they tell us, they tell us a range of things, but what they speak to me is just this huge amount of work that's going on day in, day out, week in, week out. So across the city, upwards of 80 inquiries done every week, upwards of 260 concerns being raised, and then all the work that happens and all the ongoing support that's needed around those individuals. So on behalf of the board, I would just want to put on record my thanks for colleagues who ultimately make the difference.
Thank you very much for that, and absolutely right, those frontline staff keeping adults safe across the city are fundamental importance. Just give an opportunity for Caroline or Councillor Arif if they want to make any comments at this juncture. If you don't have to. Caroline?
I would just like to emphasise a little bit of what Richard has said about us absolutely being an authority and a partnership that believes in continuous improvement and continuous development. So some of what we have to do is in response to and being reactive to circumstances that have arisen following Safeguarding Adults reviews, but a lot of the work of the board that our partners support is proactive work. It's trying to be on the front foot and developing our safeguarding approaches, improving our practice on a regular basis, and also a really strong emphasis on working with our communities and doing it in a very sort of co-produced way, and really, really proud of the work that we have got ahead of us going forward into 25, 26 as well.
Yeah, Chair, thanks. I thought I was opening, I had some opening remarks. No, it's totally fine. I think a lot has been said by Richard and Caroline. I think from my perspective, this is obviously really important work. Richard, as an independent chair, did fantastic work. I think a couple of things that I picked up, obviously, from the report in terms of the work that's happening with the ethnically diverse communities. I think that's really, really strong and quite powerful, and I'm sure there'll be a lot of learning in relation to that. But also in terms of the multi-agency work and the plans for that, I think it's really important that as a city we work on this agenda together. So yeah, really important and valued work, and I look forward to the views of the board in terms of this discussion. Thank you, Chair.
Super, thank you very much. So members, if you want to ask a question, please indicate. And just to sort of start us off, Richard, on page 29 of the pack, there's the appendix to the data. And at the top, there's a number of safeguarding concerns numbers that have been raised, etc. And then there's the word conversion rate. I just wanted you to clarify, obviously, where that should be is probably a little bit subjective, because it depends on the types of referrals, etc. But it'd be good just to get your idea of where you think is a good number, or do you think you're in a good place there? Thank you.
Okay, thank you, Chair. So just for clarity's sake, that is the number of concerns. So anybody can raise a concern, and it's important that people feel confident to do that. So all sorts of concerns are raised and then dealt with by Caroline and Shona's colleagues. The conversion rate is the number of those that then become a Section 42 inquiry, which is where the local authority, as the lead agency, undertakes an inquiry, an investigation into the circumstances and the concerns that might sit around an individual. The rates the rates in Leeds kind of match the national kind of picture, where the average is about 1 in 3, just under 1 in 3 being converted. So if you look at that rank of local authorities in England, Leeds sits sort of somewhere in the middle. I don't think there is a right or wrong number here. I think it would be impossible for Shona and her colleagues to be able to manage a conversion rate of 70, 80, 90%. And I would be really worried if that was the case, because I think it would suggest that there were other concerns that just weren't getting shared. Because importantly, I think, as I said, it's right that people feel they can raise a concern, even if it doesn't become an inquiry, because there's an opportunity for a conversation and a review, and there's an opportunity for some support back to whoever the practitioner is who's raising the concern about what it is that they might do to continue to support the person. So that work is kind of unseen and not always visible, but absolutely critical. So I think the rate feels absolutely okay in relation to the national picture, and as I say, the national picture is at times clouded by the fact that some authorities, for instance, do have an approach which is that to take any concern raised and to turn it into an inquiry, and I'm not sure that's the right position either. So for me, as your independent chair, it feels in a position that is appropriate. I would be more concerned if we were seeing concerns reducing. That's where I would be worried.
Super, thank you very much, Richard. Okay, I'm going to bring in Councillor Buckley. Thank you.
Thank you. My question is not necessarily about the work of the board, but it's about this new logo, the Safeguarding Adults Board logo. Can you tell me, why do you think this new logo was needed, what the cost was, and what the benefits of it would be, what the benefits of a new logo has achieved? Thank you.
Okay, thanks, Chair. We responded to what citizens were saying about and representative groups were saying about the way we were presenting ourselves a couple of years ago. We had a jigsaw that had a piece missing, and it didn't really mean anything to anybody. So we've worked with citizens who are ambassadors, some who might be known to this committee, but they were very clear that it didn't really kind of help them explain what we were about. I don't think a logo can ever do that, to be honest, but certainly the one we had didn't work. So we listened to what people were saying to us, and we ran a competition with people across the city. We had a number of people come forward with proposals and ideas, and then we worked with that group and with the company who did the design work to extract from that both a kind of just a more obvious logo. And the thing that people have said to us is we want it to say something about people, and you can't do too much about that other than insert into that A somebody with their arms outstretched. So that's what people wanted, and our approach was, given that we co-produce a lot of the work we do, we needed to listen to that. So the company that we work with, both for this and they do our work around leaflets and other material, know us, they know us well, they work with citizens, they did some of that work and produced this latest iteration of the logo, which people like. We've gone with a different set of colours. The overall cost was about £700, but that included some of the engagement with people, which is absolutely critical, and then coming back with some ideas about what we might want to do, and ultimately we put that back to that group, and they liked it. What's been the impact? Well, I can only speak for one or two of those people I've spoken to who like it. It feels more accessible, a little bit more obvious, but we'll have to see. Some of that impact will be measured by hits to our site. So if you go onto the Leeds Safeguarding Adults Board site, that now looks, and you know, we thank the council for the work they did there to help us put our site on a better platform. But we're using the logo and the images throughout that site too. I hope it's more accessible. I hope it's a little bit more obvious. But that's as far as I could go at this moment in time. Thanks, Chair.
Super, thank you very much for that answer. Okay, I'm going to bring in Councillor Blackburn next.
Thank you, Chair. I've got to say, really good report. But on page 21, 2.2, about safeguarding within faith communities, you mentioned that you're in the process of doing something for the 6 main religious faiths. One of the questions I have, we've got quite a lot of different faiths in this city. Beyond the 6 that you mentioned, what are we doing for those, and what are we doing for those people who have no faith, or no religious faith, that is. And the other thing is in next steps, you're talking about the new guidance to be published early in 2025. Can you be a bit more definite of when that's likely to be published? Thanks.
So I think what I would say is that no piece of work can be completely comprehensive, and we're not trying to suggest that this is the case. For people without faith, in a sense, then we've got to think about our overall approach anyhow, but there are, I think, specific issues in relation to how we work with faith groups and how we use those networks, just as we would be working with other forums in the city and other specific communities of interest. So what we've done here is we've undertaken a piece of work, not on our own, but with a number of other safeguarding boards, including children's partnerships and the Children's Partnership in Leeds. We've worked with representatives of those kind of key main faiths, that's how I would describe them, and we're working that forward with colleagues in the Children's Partnership. We're going to hold a consultation event with a range of key players, and I haven't got the date for that, I'm afraid, in my head or in front of me. It's in the next 2 or 3 months. We'll then ensure that we engage in an event where we listen to what people have to want to say to us about the advice and the guidance that we're putting forward. We'll amend it so it absolutely fits the Leeds situation, and then we're looking to hold a conference later in this year to launch it, and as I say, to launch that with children's at the Children's Partnership too. So I get back to you, Councillor Blackburn, separate to this meeting, but it's in the next 2 or 3 months. We're looking to hold that event.
Right, thanks. Yeah, that's all right.
Thank you for that. Can you send that to Angela, and then she can share it around the board? Thank you. Okay, I'm going to bring in Councillor Ritchie next. Thank you.
Thank you. Thanks for the report on the work that you do. Really important, excellent work. Just going to the Appendix 2 again on page 30 and the mental capacity assessment outcomes. Does the figure of the percentage support where people have support reflect the nature of the reporting and then the support that people are put in contact with or have at their disposal, rather than it reflective of a cohort being missed.
Thanks, Councillor Ritchie. I think I'm going to ask colleagues from Adults and Health to pick that one up. These are statistics. They're a national return that each local authority has to provide, and Leeds obviously owns this data. So I don't know if there's somebody to my right who'd want to pick that up. So it's on the second page, isn't it? Mental capacity assessment outcomes.
Have you got another question, or shall we? Do you want? Can you respond? Or do you want a bit of time?
I'd be grateful if you could just repeat the question again, please, Councillor Ritchie.
So I'm asking if that encouragingly high figure, 93%, is actually reflective of the nature of reporting and support that's then offered. So someone might report it and ensure that they've got support, so really positive, rather than it being reflective of a cohort being missed. So people who don't have family support in place and not, these issues aren't being raised. Makes sense?
So I can say, Councillor Ritchie, of those people who lack capacity and weren't supported by an advocate, family or friend, we provided advocacy to meet the gap. So 3 groups of people that have capacity, people who lack capacity, and people who are supported in their lack of capacity by family and friends. So that's the way that data is presented. So there's no missing group?
I think it'd just be worth having a follow-up to that question, if that's okay. So if you can liaise with Councillor Ritchie and Shona to make sure we get to the bottom of that. I think the question. I think there's a question around who's being missed in terms of if there's people who don't have capacity to support themselves. Is that 7% of those aren't getting support? Is that? But I think that's right. But I think we just need to clarify that in writing outside this meeting. Okay, thank you. I'm gonna. Do you want to come in again, Councillor Richard? No, thank you.
I think what Sean is saying is the other 7% are supported by yourselves. So this is.
Yeah,
let's
make sure we get to the bottom of that. I think we. Yeah, so I think what I'm proposing is Angela, Councillor Ritchie and Shona have a conversation, and then once we've got to the bottom of it, that's shared with the whole board, if that's okay. Good. Okay, I'm going to bring in Councillor Gibson next. Thank you.
Thank you, Chair. And yeah, I just want to echo what my colleagues have said. Great work, and thanks for everything that you do and for the great report. I just wanted to ask you for a little bit more information. You've already touched on one of the cases that you brought up, but it's specifically to do with people with learning disabilities that have capacity, they're involved in risky behaviour, or perhaps have reported abuse of some form. What work are we doing alongside, and I'm being very specific here, alongside the police to support those people? I presume there's a role for you guys. I understand that you've got the ERF, and that'll take care of a few of these cases, but in my experience, there is sometimes a gap between what we're able to do as social services and actually needing police support, but actually police feel that due to inconsistency of evidence and things like that, they're unable to act. So, and I presume there's a role for you guys there to be able to sort of support the police with training and that sort of thing. So it's sort of an update. I ask it pretty much every time you come. Maybe not for the past year or so, but it's sort of an update on that, really.
I'll also ask Shona or Caroline to just say something from an operational perspective, because I'm not responsible for that, and I'm not involved in that. But in relation to, I think, the wider issue, one of the things we are doing, and it sits under the work we're doing that's reported in here around the Social Care Institute for Excellence. So we've we've looked at what are some of the barriers that prevent effective working. What are some of the things that stop people coming together and ensuring that, in a sense, it isn't criteria for a service or whatever that gets in the way. What you start with and focus on is the need of an individual, and part of that is as a result of some of the learning we've done through safeguarding adult reviews, and Miss I was somebody with a learning disability, where what we learned from the review that we did was that, in a sense, the abuse that she suffered, we can't say it would have been prevented, but there was exactly the situation you're talking about. There was a previous concern about a member of staff that didn't meet the criteria for an ongoing for the Crime Prosecution Service to progress a case to court, but where there were concerns, and in a sense that somehow got lost, and that member of staff continued to work in the service with vulnerable people with learning disability. So what we've done in this piece of work around working together is we've held a specific set of workshops with frontline staff across all agencies who are working in the field of learning disability. And on the back of that, we're now looking at what are the things that need to change. So, for instance, what is it that happens when you don't have a clear model for how you work with somebody in this situation, when actually the kind of criteria for an investigation or an ongoing police investigation hasn't quite been met, but actually there are ongoing issues to manage. What do we need in terms of more specialist support for people in those situations? So that's part of the work we're doing with the Social Care Institute for Excellence at a more strategic level, and it could be that you'd also want to hear from colleagues in adults and health about any kind of practical operational work that goes on in those circumstances. So I think we're recognising that there's lots more to do, and there's work underway to do to address those issues. Don't think it probably answers all your question, though. So.
Thank you, Richard. I really look forward to the conclusion of the work that we're doing with Social Care Institute for Excellence, because it is all about how do we work with people who may not yet be at the point where there's a safeguarding concern, but where they're living with risk. And that's the question that you were asking, Councillor Gibson, is how do we support people that are making unwise decisions and living in a risky situation? No.
Can you put your speaker back on, Councillor Gibson? Thank you.
Sorry, Chair. What I'm asking is where people they have capacity, but have a learning disability. Perhaps they're living semi-independently, or perhaps they are living independently. They're taking part in risky behaviours, probably maybe being abused, neglected. Well, let's say abused of some sort, financial abuse, whatever it might be. The police are finding it difficult to be able to initiate criminal proceedings because of quality of evidence, inconsistency of evidence, all that sort of thing. It's incumbent on us to obviously try and do what we can, but they're still taking part in those risky behaviours, and it's very difficult, given that the person has capacity, to be able to support that person. So it was more of a question around that. It's really, I mean, it'd be better if the police and CPS were here, of course, but they're not. So I'm asking you guys, what are we doing? Is there training that we're offering the police? How are we working in partnership with the police to try and improve that situation? Because it's an experience that I came across a lot in my practice.
So at a very direct level, the work that we do with people through our safeguarding and risk managers, who you'll be aware are senior social workers who have an expertise in this area, they will deal through the risk assessment management plan that we have, and they'll engage the police in those conversations at a very direct level. However, I can't give you any outline of anything specific around training with the police other than the day-to-day contact that we have with police officers through managing the risk that people are living with. So it's a useful, very useful question. Thank you.
Yeah, I do ask it because I'm concerned about that particular group and history teachers, where there is a vulnerable group, sometimes they can slip through the net. You know, it is a small percentage of our city, but nevertheless it is there, and that's why I keep asking the question. And I understand that there is a limited role for us as a local authority, in the sense that what I'm suggesting here is that there is a criminal act being against them, perpetrated, I'll get there in the end, against them. So they would meet the threshold for a criminal investigation, but because of, as I've said, problems with evidence, the police aren't able or willing at some points to act. So from our side, how are we able to try and support those situations to move on, and the police to be able to take action that we require of them? Again, very small percentage of cases, but that's why I will continue to ask the question.
Thank you for that, Councillor Gibson. You're absolutely right to raise that, so thank you. Okay, I'm going to bring in Jonathan next. Thank you.
Thank you, Chair. I just wanted to ask something about the key challenge that's set out on page 27, where you're talking about member organisations measuring the impact of the board's ambitions, and whether you could unpack that a bit so we understand what that actually means and how you would know if it's improving, please.
So I think we are clear that you can do all you want to do in relation to producing materials, running conferences like we're doing next week, providing learning events. But what we know from the work we do, and we have a range of approaches to quality assurance. So we undertake an annual audit which partners fill in, flagging where they think they are meeting the requirements of the board. We do in-depth multi-agency audits. We do appreciative inquiry events where we take a case and we look at what you can generate in terms of learning. And then we're dependent on our partners to take that back into their organisations and amend their approaches and the ways of working. So I think we've really pushed that, and there's lots of approaches that we have to how we think about quality and getting assurance. But what we haven't perhaps got far enough down the line on is taking the kind of audit work that each agency does as part of their kind of annual plan, and then beginning to feed that back into the board. So that's beginning to happen. We've had a number of partners coming back to us and saying, look, this is the evidence, this is what we have found as a result of a review of safeguarding activity in the hospital trust, and these are the learning points for us, and these are the things we want to tell partners about. So that's in a sense the phase we're now in, and what we're doing in February actually is a further piece. So we're saying we've asked people to go away and look at assurance and what's happening around outcomes in terms of care settings. So that could be a hospital setting, it could be a residential nursing setting. And each of our partners have gone away, they're undertaking an audit, they've specified what it is they're going to do. And we're coming back as a board to do a sort of learning event to share what has been generated by that in terms of the difference it's making to people, and we'll see what that flags. The other thing we do is we operate with a whole range of existing partnerships and existing processes, and have our own Friends of the Board network, which has about 30 or so organisations that's engaged in it. And every year we undertake an annual conversation with people who either represent people with lived experience or have a particular perspective to bring. And our last conversation with that group last year was around what is happening for people, and what are people's experiences as they enter into the inquiry process. And we are running a further session in about 6 weeks' time, where I think Shona is going to be present. Key partners, leaders from health, social care, the police, and they will come back and tell people on the back of what we said to us last year, this is what we're now doing about improving and establishing evidence that we're making the difference. And we will, as part of that conversation, hear other information, I'm sure, that then will feed into how we kind of close the loop and over the year do further audit activity. So I think I would suggest it's a difficult thing to do. The board can't do it of itself. It needs to be working with its partners and the audit work that they do. And we need to cross-reference it with what people are telling us in all sorts of interactions about their experience of what is happening to either themselves or people they represent.
Thank you. I just wonder, I mean, that's very interesting, your description there, and I just wonder whether, given the role of scrutiny across the whole system, whether that might be an area that it will be useful to get a report back at some point, Chair, because we'll get a better understanding then of how well the system is working, because when bad things go wrong, it's usually because there's glitches somewhere in the way all of that's working. So I think it would be good to put a magnifying glass on that a bit.
Super, thank you very much, Jonathan. Angela's made a note of that, and we will we'll take that away. I think it's interesting. I was talking to Angela earlier today about how we need to start thinking about the proposed work schedule for next municipal year already, and so that's definitely worth putting on the list of potential items. So thank you for that, Jonathan. Okay, I'm going to bring in Councillor Rontry. He's the last person that I've seen, so if you want to speak and you haven't, do indicate now. Thank you.
Thank you, Chair, and thanks for that report. It's a really interesting read. I'd like to ask Richard, if I may, about your approach to board values. And I think looking at the values you defined here, I mean, most of them I think are probably good values for any service providing organisation to aspire to. I'm just sort of wondering how they came to be defined and how they inform your practice, and do you know that they're helping? Do you have evidence that you're meeting them and that's sort of driving what you do? Thank you.
Thank you very much. So the values that we work to, as you say, are not going to be kind of what would I say? I think they make sense, and they're going to be values that other partnerships work with too. I think that they don't come out of nowhere. They come out of two things, I think. One is the kind of statutory frameworks that we work within and the guidance that we work to. So the working with an approach that's proportional, empowers people. Those are national statements of guidance that boards need to work to. I think in any locality you have to make something your own. And I think what has driven the values approach in Leeds, in my time as independent chair, is the work that we've done with citizens. So we, 4 or 5 years ago, did a fairly new thing, which was to work with citizen groups to hear what it was that they were saying good would look like from their perspective in relation to being involved, in relation to... So the issue of proportionality doesn't kind of mean too much until you translate it, I think, into the experience of somebody. And for me, that would mean. So that's the piece of work we did. It sort of set our procedures and our processes centred on what people were saying to us about what good should look like, and in a sense that has driven the value approach too. Now the evidence for kind of how it works, I mean, we see that when we do case reviews, we see it when I see it when I get out and talk to partner organisations or meet frontline staff. We're not expecting people to kind of have them on on a card that they keep in their pocket, because all that is a little bit superficial. But I think ultimately it's driven, sure, by a sort of national framework. But in Leeds, I think it's absolutely kind of driven by what it is that citizens say to us and continue to say to us about what makes a difference, what means the most for them. And that kind of approach has attracted lots of interest from other places. People are always coming back and saying, how, can we take your stuff? And our advice to them is, you can use it, but unless you co-produce it with people, in a sense you undermine the whole value of the process anyhow. So I don't know if that helps, Councillor.
Thank you. Yes, it does, and that's yeah. So it's really good to hear that. I mean, I was actually going to drill down a bit into the citizen-led, but I think from what you've told us there, you've pretty much covered it off. It just occurred to me that's quite distinctive. Whereas I think, as I say, the others are right and worthy and sensible, but not particularly exceptional. But I think it's the citizen-led option did particularly catch my eye. But sounds like a really worthwhile exercise. Thank you.
The only thing the final comment I'd make about that is that I think it has to be caught to what we do. It's a bit to the question that Jonathan asked just then. How do you know it's happening? Well, as I say, you can see it when you go and talk to people, but often difficult to be able to then translate it into hard evidence about, do you know what, we've improved our approach. I don't think it quite can be measured in those ways. What I think can be measured is people's passion to do the right thing for the people that they're, as I say, engaged with this afternoon, and to do that in a way which leaves that individual as far as possible in control of the process that they're going through and in control of their life.
Thank you, Richard. Okay, Councillor Francemeer.
Thank you very much. Thank you for the presentation and all the work that you're doing. I just want to clarify something on the statistics. It says modern slavery has been 0% for the last 4 years.
So what I'm going to do is go to my colleague here who understands the statistics inside out. I don't think it's 0, but it's at a level probably where we're still not able to translate it into, given the numbers, a percentage. What I would say is that modern slavery is something that partners across the city are working on, both through the Safeguarding Adults Board, Safer Leeds, and other partnerships too. But on the statistic itself, I will pass to a colleague from Adults and Health.
Thank you, Councillor Francemeer, for that question. What we do know that we do experience people who've been subject to modern slavery. Quite often it's with another type of abuse, and if that's the primary type of abuse, that's the one that will go down on the recording. So if it's physical sexual abuse and that's the primary issue that's come to us, then that would be first, and then modern slavery would be second. It is a relatively low number of people who are experiencing modern slavery who come through the safeguarding process, because it requires people to have care and support needs, or a suggestion that they may have for it to move from the police environment into the safeguarding environment with the criminal activity as well. So it's not to say that modern slavery doesn't happen, it does, but it's just a small number of those people who come to us who've experienced abuse. So the number is small, and then it gets smaller because we don't always put it as the primary abuse category. Okay, thank you for that.
Thank you. That's really helpful explanation, Shona, so appreciate that. Okay, good. So I think we've got to the end of the questions for this item. So thank you very much, Richard, for your time. We, as a board, really appreciate the work you do, and obviously safeguarding adults in our city is a massively important issue, and we need to make sure it stays like focus. Like you said at the start, we should thank the people on the front line keeping adults safe in their day job. So that's a heartfelt thank you from this board. So with that, I'm going to close this item. There's a couple of people, 3 people, I think, Dawn, Sarah and Steve, who now come to the table to talk. I think, Richard, you're okay to go. So this is the performance update. So what I'm going to do, just so you know, I'm going to break it into 3 sections. We're going to talk about the public health section, and then we'll do the adult social care section, and then we'll do the active lifestyles section. And as we go through each bit, I'll tell you which pages we're looking at in case you've made notes on your pages about which questions you want to ask. So just as these 3 sit down, they can introduce themselves, if that's okay. So can you introduce yourselves now? You've had a chance, well, not much of a chance to sit down, but thank you.
Hello, my name's Dawn Bailey, Chief Officer for Public Health. I'm standing in for Tim Fielding, who can't be here today.
Thank you.
Hi, I'm Sarah Erskine. I'm Head of Health Inequalities in Public Health.
Afternoon all, I'm Stephen Baker and I'm the Head of Active Leeds.
Thank you very much. So we're going to start with the public health section, and so the main sort of charts and graphs of pages 37 to 54. I'm going to ask Councillor Venner to introduce this, and then we'll do questions on this section.
Yeah, thank you. I'll introduce this, and then Dawn and Sarah might want to add further comments. So I think probably one of the highlights to talk about to begin with is that inequalities persist, and that's quite a strong theme within any area of public health that you look at, whether it's smoking cessation or suicide prevention or public mental health. You're more likely to have lower life expectancy, end your own life, die prematurely if you're from a deprived area. And obviously there's intersectionality around inequalities as well. So I think that's a really key theme, that inequalities do persist, and that's why the Marmot work that we're undertaking is so important in terms of providing a real focus around inequalities. There are some really real positives though in this report. I'd particularly draw out the reduction in admissions to hospital for alcohol-related illness, and also the reductions in admissions around self-harm. And having worked myself directly in the recent past with these issues when I was in mental health crisis services, that does really demonstrate having an impact on some particularly vulnerable people in our city who have complex needs. I think another positive is that we have a better than average take-up of health checks in Leeds, and I know that's something my predecessor, Councillor Arif, was very passionate about when she had the portfolio. And one of the things we really promote and prioritise is health checks being taken up in the more deprived areas. So the fact that we've got a better than England average in a city with the complexity and the demographics of Leeds is really positive. I also wanted to highlight our work on childhood obesity, because I would understand if absolutely nobody listened to this, because it was at 7:20 in the morning on New Year's Eve. But Leeds was featured on the Today programme on Radio 4. As some of you will know who listen to it regularly, they have guest editors over Christmas and New Year. And Laura Kenny, the Olympic athlete, was a guest editor, and she wanted to do a piece on childhood obesity and its link to the decline in PE in schools. And the reason the BBC chose to record in Leeds is specifically because they said we've got a really good story around reduction in childhood obesity. So they interviewed me, and they also went to some primary schools. It was pre-recorded to look at some preschool exercises that were happening. And so we've had a recent decline in childhood obesity, and we're at the same level as the England average, which again is actually really good, given a third of our children live in the most deprived area. And also, we have an increase in breastfeeding rates, and that's really key in reducing childhood obesity. And they didn't. I think this bit did get captured actually in the bit that they broadcast of what I said, but I talked a lot in my interview for the BBC about preschool to tackle childhood obesity. That Laura Kenny's focus on school is really understandable and right, but actually you have to tackle childhood obesity at a younger age. So the fact we've got an increase in breastfeeding rates is also really positive. You'll notice that we've got a higher rate of new. Sorry, I'm being really incoherent. Our rate of new HIV cases has increased, and that's attributed to people coming into the country with HIV. But I think it's also worth noting that we're a fast-track city, which is really important. It's part of a global network of cities that have committed to there being no new diagnoses of HIV, Hep C and TB by 2030, and that means we're doing a lot more testing. So we've got things like people being automatically tested when they present to A&E in Leeds, and the fact that we're doing more testing means that we're going to get more cases. So it's not necessarily a bad thing to have more cases, because it means you're linking people into the treatment that they need and the support. Just my final point that I'll mention is there's a statistic around low rates of people with learning disabilities who are in employment. And there's quite a big government programme at the moment around work and health, which will lead to some money coming to West Yorkshire and then from West Yorkshire being devolved to us, where we will be able to target people who are outside of the workforce because of health issues. It's very much about getting people back into work who are unemployed due to health issues, but it just means some of the really vulnerable populations, like people with learning disabilities, will also be able to capture in that work. I'll leave it there, Chair. Thank you in terms of my introductory comments.
Thank you very much. Dawn, do you want to say anything or move to questions?
No, no more to add. Just happy to take any questions.
Great, thank you. So just to be clear, Board, we're looking at primarily at pages 37 to 54 of the pack in this bit, and then we'll move on to the next section. So if you want to ask a question, please indicate. I've got a question around infant mortality on page 42, which has gone up per thousand. I noticed the comment on page 38 saying it's not statistically significant. I just want to put on record my concern, particularly for the most deprived areas. It seems, so whilst it's a small number, absolute terms, it does seem significantly higher by eye than the least deprived, and it's a concerning trend if it's going up. But I note the comment, so you don't need to necessarily comment, but you can do if you want to. And I'll bring in other people. Do you want to comment, Dawn, or?
Well, just to say, as you said, the infant mortality rate is showing a slightly upward trend. The numbers are extremely small, so the overall trend is really vulnerable to fluctuations. What I will say is that infant mortality is a priority for the Best Start and beyond, and remains under monitoring and surveillance by the Child Death Overview Panel. So it is an absolute priority, and we continue to keep a really close eye on it, but there are very small numbers, so it does show up in the trend line if there is a slight change.
Super, thank you. I'm glad it is a priority. Okay, Councillor Anderson, I'll bring you next.
Thanks, Chair. Just following on from what you asked just now, the infant mortality rate, forgive my ignorance, but is it what age? Is it 0 to what age, please?
Infant mortality is up to the child being 1 year old.
1?
Yeah.
Do we have any examples of any other areas of the country or other countries where to compare with? Because I don't know if that's a lot or not a lot. It sounds terrible because everyone is terrible. But is there a comparison for, you know, developed world, say?
So happy to answer that question in relation to comparing to cities of a similar size and characteristic to Leeds, and we are mainly on par with other cities similar to Leeds. what I will also say is that within Leeds, we know that the number is under 10 in the last 3 years, but also know that so they are very small numbers, and each of those deaths do get investigated, and we do compare what we're doing in Leeds to other parts of the country. But it's about on par with other cities of a similar nature to Leeds.
So I've got another question about the use of the BMI measurements. It's on page 39. So I thought we'd stopped using BMI as a measurement nowadays because it wasn't given a true picture, yet we're still using it in here. So it was a bit misleading. The example that used to be given was rugby players who had a large BMI, but they were very, very fit. So.
Yes, I think it is still the measure that we're using as per the NHS indicator, which means it then is included in this report. So I think we are still using it at the moment. But I understand your concerns.
National measure.
Yeah.
Sorry, one more question. On a lot of these paragraphs talk about inequalities between areas of deprivation and better areas of the city. And despite the amount of work public health are doing, why is this not moving in a better direction? What one thing do you think we could do in order to move this in a better direction?
Yes, thank you for that question. I think the answer to it is that there isn't one thing that we can do. The causes of health inequalities are very, very, very complex and diverse. And we know that around 80% of what contributes to health is where people live, where they work, whether they can access their parks safely, whether they have a good education, what their employment is like. So whilst public health does huge amounts of work, this is the purpose of the Marmot City as well. It's really incumbent on us to design a world that is healthy. So we asked Michael Marmot actually when he came to the city what one thing he would do, and he wouldn't give us one thing, but he did give us 3, which I can't remember, but the employment, education and transport, I think actually were the 3. So I guess my response is it's not just public health, it's about how we design the city and the world to be a healthier place for people to be born, live and grow older in. And there's not just one thing. We all need to work as a system to make those changes.
Thank you. I do think the wider determinants of health issue is something that we definitely talked about previously in this meeting, and something we do need to keep focus on because it is really important. I'm going to bring in Councillor Venn. I assume you want to comment on this point.
I just wanted to respond to a couple of points, mainly around infant mortality. So, although, as my colleague said, infant mortality refers to up to 1 year old. Obviously, if any child dies in Leeds, that's investigated. The panel's called the Child Death Overview Panel, and it's chaired by Catherine Ingold, who's the public health consultant who leads on children. And that will look at all the factors that led to a child's death, and it will direct our work if there are obvious things we can do. So, for example, when I was first the Cabinet Member for Children, we had a couple of deaths where children had, not babies, but toddlers had died through drowning, through being left in the bath. And so we did a campaign around safe bathing. Similarly, there are local and national public health campaigns around safe sleeping, because lots of babies die due to co-sleeping. I've just Googled a report. You might have heard me reference this in full council when I have the children's portfolio, but I would say, and obviously I'm not a public health professional, but I would say the biggest risk in all public health risks is poverty. As I said in my introductory comments, you're more likely to die prematurely if you're in an area of deprivation. You're more likely to end your own life, you're more likely to die from smoking-related disease, from obesity. There was a report done between April 29 and March 2020, which looked at child deaths over that period, and stated that this report stated that there were 700 additional deaths nationally, which were directly caused by poverty. So this is a report that really explicitly link child death to deprivation. And it's through modifiable factors, as they're called, like co-sleeping, like smoking in the house. So there is, my view would be poverty is the main underlying risk factor. And there is some evidence around that. Thank you.
Thank you, Councillor Bennett. If you could share that with Angela, that report, and she'll share it around the board, I think that'd be interesting reading for us. Okay, I'm going to bring in Councillor Ritchie next.
Thank you, and thank you for your report. I've got 3 hopefully quick questions. The first is a bit of an observation, and I welcome in the breastfeeding improvements. I did have the pleasure of attending the launch of the manifesto, and I just hope that there'll be support for that, to implement that at Leeds, to make Leeds a more breastfeed welcoming place. So it'd be good to hear of that commitment from my colleagues up the row. In terms of the best start, are there any common reasons for children being taken into care? There were 100 mentioned, so I'd be interested to know if there were certain issues that were prevalent, maybe abuse, specific abuse, or drug addiction, born drug addiction, things like that. And then finally, on emergency admissions due to falls, I imagine that can be seasonally affected. So I do fear, following the last week, for next year's figures, because I do know when I was looking through past emails, chasing up gritting and whatnot, 2021 was the last time that we had a severe winter, which might account for the small drop in 2023. And I do think the way that we deal with such a week that we've had needs a strategic review. Thank you.
Hi, thank you for the comments. I think the first one to note around the best start strategy and your question around commonalities of reasons of children being taken into care, we will have to get a response back to you on that. I can speak to Catherine Ingold and we'll get a response back to you, a written response back to you. Take your point about the falls. Obviously the last week has been obviously horrendous for weather and slips and trips. We do continue to prioritise that work with working alongside NHS colleagues and third sector, and we will continue to monitor and look at to see what the impact of cold weather has had on that in recent weeks. And then obviously we'll take your point back around the breastfeeding improvements and what support can be given. I think your comment was the support that you can give to that, and we will feed that back to Catherine Ingold as well. But the written comment will come to you on the reasons for people being taken into care.
I can probably respond on that from obviously having had the children's portfolio for a long time. So children are taken into care almost always because of abuse or neglect, more commonly neglect than abuse, much more commonly. The really, really nasty cases where harm is deliberately inflicted on children are mercifully rare. Most people want to parent their children well and for various reasons are unable to. So overwhelmingly, children are taken into care because of neglect rather than deliberate harm to them. And they're always taken into care pretty much because of the behaviour of adults. So common factors include mental health problems, substance misuse and domestic abuse. Very often a combination of all three. As you'll know, there's been a rise in adolescents being taken into care over the last up to 5 years nationally as well as locally for really complex reasons. They're usually at very high risk, and a kind of change in the safeguarding lens has been to looking at risk outside the home, because when adolescents are taken into care, it's very often because of things like child sexual exploitation and criminal exploitation, which is outside the home rather than within the home. However, it's still the behaviour of adults. You know, even when children are committing criminal acts, they are usually, or almost always, being exploited by adults. However, we did have that great presentation on at Labour Group on Monday about the fact that our numbers are reducing, which is incredible given what's happening nationally. And that's really because of the amount of resource and energy we've put into things like the reunification team, which is enabling children to come safely back into their families, and also that we're still investing a lot in prevention and early help to families despite the financial context. Thank you.
Thank you very much, Councillor Venner. Okay, I'm going to bring in Councillor Blackburn next.
No, thanks, Chair. I've got to say, quite an extensive report, and the figures here are really useful. But I'll ask a question I asked many, many years ago when they had this, when I was on the executive board myself, and when we had figures brought to us about this, which I think actually, with the fact that people are retiring later now, old age pension you get later now. I'll ask a question: why don't we keep figures about people, about the date when the age when people retire from work? I've got to say, if you've got a physical job and you retire in your mid to late 60s, quite honestly, within those last few years, you deteriorate a lot. And I know this from my own experience from working in engineering. My own father retired at 62, and he lasted a lot longer than most of the guys that he used to work with. And we don't keep those figures. And I think, quite honestly, it's important now that the old age pension age is going forward that we do it, because quite often those that have got the less physical jobs actually retire more earlier than the ones that have got the physical jobs.
So I think there's a question around is this a public health thing that you should be measuring, and are you measuring it?
So locally, I'm not aware of any figures which record the age that people retire at, but something that we are really interested in public health is healthy life expectancy. We don't have data at sub-Leeds level, so we can't look at it in a lot of detail across the city, but there are some national plans underway with the Office for National Statistics to enable that to happen. And why it's a really, really important public health issue is the reason that you've just talked about, which is healthy life expectancy in the more deprived parts of the city is much, 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 much shorter as well. So people could be living with 1, 2, 3 long-term conditions before they retire, and then retire and perhaps develop more. So there's something about how we think about it being an age-friendly city, how we think about healthy life expectancy, and how we think about deprivation, all within what you've just talked about. So we don't keep the figures yet, but it is something we're really, really interested to understand.
Just out of interest, I think it'd be difficult to do because increasingly with flexible retirement legislation, I think it might not necessarily be the case where people would retire partially or go part-time or whatever. But interesting conversation nonetheless. Okay, I'm going to bring in Councillor Rowntree next. Thank you.
Thanks, Chair. A quick one from me. I do apologise if this figure's in the documentation and I just haven't found it. But trying to make sense of the infant mortality stats, I wonder if we have an approximate figure for the number of births in Leeds every year, please.
I don't know it offhand. I know it's under 10,000. It used to be 10,000, but the birth rate has dropped. But we can come back to you with an exact figure.
No, that's fine. Thank you. I just wanted to try and make sense of the some of the commentary here, talking about infant mortality. Now, when we say rate of infant mortality is 5 per 1,000, we're talking 1 in 100, aren't we? Half a percent. Agreed? I'm just trying to follow this on to the final sentence in the paragraph about infant mortality, where it says, very small number of infant deaths account of less than 10 over 3 years. So we're talking around 3 infant deaths per year in Leeds, and 10,000 births. that's not 1 in 200, is it? That's substantially less. I'm just a bit lost with that, that's all.
So I think we'll have to come back with you with a more detailed response when we've spoken to Catherine Ingold. I will just say how we talk about it is deprived Leeds, which is a terrible way of talking about it, but the most deprived parts of the city, there are more people, there's a greater proportion of people living in that part of the city than there is in the least deprived. So it is complex and complicated. So I think we'll probably take some time and come back to you properly with a fully worked up response, if that's okay.
Yeah, okay, thank you.
Yeah, that'd be very helpful. And if you can send that to Angela, I think that is really important and really important number crunching there. And Councillor Ontry, so thank you for that. Okay, so I'm going to move on to the next part of this report. So we're going to look at pages 55 to 63, and I think Councillor Arif will want to say a few words, and then we'll move into questions unless it's coming.
Yeah, thank you, Chair. So the report presents an update on adult social care activity levels and the latest position on key performance measures nationally and locally. I'll just pick up a few key points and highlights, if I may, Chair. As of 31st of October 2024, adult social care provided long-term support to 8,811 people. These figures represent a continued increase in the number of people supported, in particular those supported in permanent care home placement, which has increased by 13%. Adult social care continues to experience pressures on its services. There remains high volumes of referrals for support into the system and increased complexity of need of those presenting. Capacity to meet demand has improved with positive movement over recent months in staffing levels and a reduction in the number of vacancies within adult social care. However, national staffing data for 23-24 shows Leeds has a lower rate of social work full-time equivalents per head of population compared to regional peer and national averages. In terms of areas where we're strong or have improvement include older people care home admissions. The number of older people admitted to a permanent nursing or residential placement is lower than historical figures and below all comparator group averages. In terms of assessment weight, performance has improved over the last year with a reduction in waiting list size between April 2023 and October 2024 of 24% and a reduction in the median wait time to 24 days. Although challenges remain in the area of reviewing the care packages of long-term service users, this has improved in 2024-25 with a number of people with an outstanding review falling and the average wait for review reducing month on month. Again, challenges also remain in terms of performance in several areas, and plans are in place to improve these, including the take-up of direct payments, which I know we've had a good conversation at Scrutiny Board a few months back, which is lower than similar authorities. In terms of the number of people in permanent nursing and residential placements has increased for both age groups from 2,368 in March 23 to 2,676 in October 24, which is an overall increase of 13%. I'll pass over to Caroline if she's got any further comments, but again, looking forward to a conversation today. Thank you.
I don't have anything to add, but obviously we're here to take any questions.
Super, thank you very much. Are there questions from the board? I'll start with Jonathan. If you want to indicate, if you want to ask a question, again, just to say we're looking at pages 55 to 63 on your pack. Thank you.
Thank you, Chair. I actually wanted to pick up on what you were just referring to there, Councillor, that there seems to be a bit of an issue around empowerment in relation to particularly working age adults, because you've got this quite significant increase in people in residential care and then the ongoing issues around direct payments, and it just feels when you look at that picture together that maybe things aren't quite going in the direction I know you want. I mean, you know, empowerment is a key issue, but it feels like we're stuttering a bit around that, and it will be really helpful to know what more you're doing, what more can be done in relation to that kind of trend.
If I can come in and answer those questions, Jonathan. Yes, we're very much aware of the increase in the number of people who are of working age adults, so under 65 years of age, who are entering into residential and nursing care. To some extent, that reflects the quite complex nature of need of individuals. But we do constantly benchmark against our neighbouring authorities and nationally as well. We look at use of resources data to see whether we're an outlier in our numbers. In fact, we're not an outlier in our numbers of people, of working age adults entering into residential and nursing care, because there is a national trend due to quite high and complex needs and deteriorating needs of individuals. I wouldn't necessarily connect that to people not having had the opportunity of choice, because as well as a high number of people entering into residential and nursing care, we also in Leeds actually have quite a high number of people of working age adults that are in supported accommodation, so in their own tenancies, but supported with care and support, sometimes 24-hour care and support. So really trying to ensure that we keep people living in the community setting in their own accommodation rather than in residential or nursing care. But we know, and particularly we've been working hard on a programme of work which is Transforming Care, the Transforming Care programme, and we've brought back a lot of people who were placed in hospital institutions, long-stay hospital, all over the country. And actually we've been quite a leader in Leeds in getting those people back into the Leeds area. People who were never considered to be suitable for living independently, and we're doing more work around that. So that's an area that we are continuing to focus on. We are also looking at our statistics now around whether, and our data around whether those people that are in supported living, how many of those could now actually be suitable for general needs housing. But again, general needs housing is limited in supply in Leeds, so there's a knock-on effect there. But I just wanted to assure Jonathan that that's exactly the sort of scrutiny we are undertaking around our numbers of people of working age adults in residential and nursing. One area that we are a bit of an outlier is in our placements for people with mental health needs. That's where we would be comparatively a higher placer than people of other care and support needs that are categorised as working age adults. So again, we're doing some deep dive work to understand why is it that we've got that higher prevalence of people with mental health needs entering into residential and nursing care. So that is absolutely on our radar, and we're doing a focused piece of work around. In terms of direct payments, we have explored that previously. We've got a very robust plan of action and a working group looking at how we can make our processes as simple as possible so that people feel more encouraged and more supported to choose a direct payment. So that is an area that we're absolutely aware of and doing quite a lot of work on, because we see ourselves that, the world sees direct payments equating to improved and increased choice and control. I think Rob would say that in our survey results, when people are asked about their experience and their quality of life, people actually experience a better outcome when their care and support is managed by the council relative to when they have a direct payment. So whilst the indicator is that a direct payment always means more independence, more choice and control, in reality people's experiences don't reflect that necessarily. But we are working on the direct payment statistics as well.
Can I just, thanks for that, that's helpful. Can I just pick up on one metric, which is the one on people reporting that they feel in control over their life, where Leeds does seem to be quite an outlier on that. And whether that relates to the point you were just making, I'm not sure, but useful to see what your understanding is of that.
Yes, so I think that's measure 3A, isn't it, where we're 70.9% last year compared to comparative figures between 76 and 79%. I think one of the important things to notice on these surveys is they are very small samples, although they are accurate representative samples of all service users. We do need to treat the results with a degree of caution. And as Caroline hinted at there, when we have done more detailed analysis behind these key national measures as to look at those people who say they have the least choice and control, which, given the National ASCOF framework links to direct payments, you would expect to correlate with people who don't get direct payments, it actually does correlate to people with direct payments, but it says that choice and control is not in relation to their social care, it's just in their daily, day-to-day lives anyway. So there doesn't seem to be a link between the two measures, between people receiving direct payments and people expressing they've got day-to-day choice and control of their lives when you look into the detail of these measures. The other thing I'd just mention on the other 2 points that you raised was direct payments is improving this year. So we've seen improvements on the latest year-to-date figures, and similarly the working age admission figures were high in 23-24, but have come down again so far in 24-25. And as Caroline said, we're doing lots of detailed analysis of those individuals that were admitted last year, and there is no particular one group or route of access that is behind that last year. It was just a period of time where we had higher numbers, but it doesn't seem to be sustained into this year.
Super, thank you very much. Okay, we're going to move on to the next section, which is page 65 onwards. Sorry, Councillor Ritchie.
Yeah, up to page 65.
Councillor Ritchie.
Up to page...
No, that's the next section. It's all right. 64 onwards in this section.
The next section.
Active lifestyles, yes.
Right,
yeah.
sorry.
I haven't missed that
I've gone
bit.
too early.
That's no comment. Okay, Councillor Arif, I'll let you introduce. Yeah, thank you.
Yeah, thank you, Chair. So in terms of active leaves, the fall in the percentage of physically inactive adults is good news, and continues to perform better than the averages nationally, regionally, and all of the core cities. And I'm pleased that the reduction has happened within our most deprived areas as well as our least deprived areas. Active Leeds continues to work with residents of all ages, targeting our priority neighbourhoods to encourage physical activity, which I can attest to from the work Get Set Leeds local projects does in my own ward in Gipton Hales, and I'm sure it'll be the same case in your ward, Chair, and many others. The growth in Active Leeds memberships is up to more than 30,000 from 28,000 in July. It's just shown our investment in gyms continues to be a huge success and has encouraged more people through the doors to live more active, healthier lifestyles, with swimming lessons also seeing an increase. Again, really positive report. I'm really happy to have a discussion on it. Thank you, Chair.
Thank you very much. Jane, do you want to make any opening comments? No, that's okay. I'm going to start by bringing in Councillor Ritchie.
Thank you. I should say my gone too early reference were my old running days. If you kick too early and then you get run down, it wasn't anything else. So just for clarification. Yeah, so my issue or question, observation is around on page 64, and you talk about the Sport England report on the social value of sport. And I think it's something that's omitted in the report is a focus on disability sport, because there was based on those similar figures, the government analysis, the Treasury handbook of calculating social value, etc., economic impact. There was a report released by the Activity Alliance in December 24 that said if we had the same activity levels for disabled people versus non-disabled people, it'd have a benefit of £10.9 billion. And so again, in the report, I think we should reflect on the work that we do on disability sport, but also reflect on the challenges. So, for example, I was introduced to goalball by Councillor Bromley, which is a sport for blind, vision impaired people. And whereas if you turn up to play five-a-side football, you book an hour and you get an hour. For goalball, you have to set up a tactile court, so you might have a half hour at either end extra booking to set up the court before you can even play the game. So there are additional costs for disabled sport, which are some of the challenges. So I think this sort of a report should reflect on disability sport in the city, good and bad, but also highlight those economic and other impacts that investment in that sport would have.
Yeah, I think it looks like officers are agreeing with you, Councillor Ritchie. So hopefully next time that will be included. Yeah, great. Thank you very much. Question from me on page 64. The table at the top, we have Q1, Q2, Q3 with no update, and then a number in Q4. I'm just trying to understand why we've got a number in Q4 but not in the previous numbers. And just, I haven't seen anyone else indicate, so this is your last chance on this item. Thank you.
Thank you, Chair. This is because the indicator actually changed from a bi-yearly kind of reporting to a yearly annual kind of report. So that's why, as you will see in 22-23, it's now from November to November 23. So we only get this once a year, so hence why there's a gap before we get that kind of information from Sport England, who do the national survey.
Okay, thank you very much. Okay, I can't see anyone else indicating. So with that really useful report, thank you very much for coming, and that's been helpful. We have two more substantive items in the work schedule, but we've been going for over 90 minutes. So I'm going to call a 10-minute recess. Please be back by the 1:15 on the clock on the wall. We will start promptly again. Thank you very much. And obviously, we've got two more people coming in, so I'll let them introduce themselves at the start. Thank you. I'm going to start by asking our two new colleagues around the desk to introduce themselves. Thank you.
Thanks, Chair. My name is John Crowther. I'm the Chief Officer, Resource and Strategy for Adults and Health.
Thank you, Chair. I'm Alan Ellis. I'm Head of Finance, who supports adults and public health.
Thank you very much. I don't know if Councillor Venner or Councillor Arif want to make some opening remarks. No, okay, so I'll hand over to John if you want to make any comments about the in-year report. Thank you.
I'm more happy to take questions, really, around unpicking the figures, if that's what you want. I mean, this is the first time adult social care has reported a financial pressure in many years, so we're in unforeseen circumstances, but I'm happy to take any questions you may have.
Okay, so I'll ask members to indicate if they want to ask a question. Oh, Alan, can you just turn your microphone off and then you'll get off the screen? Super, thank you. So I've just lost my train of thought there. So members, if you want to ask any questions about in-year, I think it's just worth you commenting, John, on high level what has caused the deficit and how we're getting it back. And I guess the question that will probably come in the next session, the next item, will be something around how are you sure that those in-year stuff this year won't repeat next year. And I think that's the sort of, I guess it's overlapping a bit with the next paper. I think that's the important point in this conversation. Thank you.
That's fine, Chair. Thank you. The Director is report Adults and Health. I stress I'll probably start with public health are fully expected to retain within their public health grant. Adult social care is currently projecting a 13.8 million pressure against budget. That is predominantly demand-based. As a director, as a council, we commission the vast majority of our care. We're not a provider in any large scale. I don't know if colleagues have had a chance to review the Appendix 3, but there are 3 useful graphs that our finance colleagues put together. And these highlight the changes just in residential care, which is one of our main areas of spend. And our pressure point is threefold, which is around learning disability, it's around mental health, and it's around older people. The other cohort is generally physical impairment, but that's not really been an issue this financial year. Our older people numbers hit quite high earlier on in 23-24, last financial year. This was largely a result of people coming out of hospital, the discharges, as was probably fairly common up and down the country. There were large numbers of people coming out of hospital and needing to have some care, needing to go into care, whether that was home care or residential care. Historically, whilst that was a high start point, what those graphs do show is that historically there's a trend, and that trend says that the numbers tend to drop off towards the back end of the calendar year and over the winter. And the drop off this financial year the drop off last year didn't happen to a great degree as we thought it would. And unfortunately for us, the budget had already been set. You know, we go out in December to consult on, so those late effects were not taken account of into the 24-5 budget. In terms of learning disability, on the graph, which I think is graph 3, page 113 for colleagues who've got the papers, you will see that the chart there along the bottom is referencing the pay run, which is the period of the run. You will note in pay run 8, which is roughly similar to the period that we're talking about for this financial year. But for last year, the figure was round at 957 and shot up to 995. That was a significant increase, was beyond anything we'd seen previously. And that all hit, in theory, well, not in theory, in practice, after the budget was set. So that was a pressure coming into 24-25. You'll see through 25-26 that the line has been relatively flat. In fact, the people who came in the last third of the last financial year is 3 times what we've received all year this year. So that was an unforeseen kick. My colleague Rob mentioned just before he left on the previous paper that we're doing lots of deep dives, and there's nothing to say there's anything unusual happened, no particular source of reasoning. And my colleague Shona has also, when she discussed more regionally, there's a similar theme across other areas in the region, that there was this increase in pressure around learning disability. You will also see that mental health, which is graph 4, the 3 previous years, yes, there's a growth. We would expect growth. Just ONS data, demographic data would expect a growth, but a significant kick towards the end of the year. So we came into this financial year with a pressure around demand. We've tried to manage that and struggled, all truth be told. And before I forget the last point, in terms of setting the budget for 25-6, we've built that starting pressure into the next year's figures. There are other elements that have helped bring the pressure down, which has been savings in salaries. We've managed to attract additional income through client income or grant income. But yes, the basic has been trying to manage down. It sounds terrible, doesn't it, manage down demand? And then the last thing I would say, Chair, is that we crawl all over our data. And I mentioned a few minutes ago, Rob, our Head of Intelligence, which is a wonderful job title, Head of Intelligence, breaks down our data. And again, as was mentioned, as Councillor Arif mentioned earlier, the number of people going into residential care, particularly for older people, is about half what it was last year. People going into residential care is about half. Linked into the Home First, an element of that linked into the Home First programme. But and this does sound terrible, but one of the pressure points has been people are not leaving residential care. So our numbers are staying quite high. The numbers going in are low, but the normal, for want of a much more polite term, the churn of people coming in and out has not been maintained in previous. We have noticed in the last pay run that those numbers of people leaving residential care has kicked in, albeit a little bit later than usual.
Super, thank you very much for that. Councillor Kidger, do you want to come in?
Just reading through this, I can't see any, and I know it's happened in my area, or it's going to happen in my area, Knoll Manor, and it's going up for sale, I understand. Will that reflect in the next figures?
I'll come in on that. There are not likely to be any significant financial implications because the residents that were at Knoll Manor have moved now to alternative care provisions, so they still attract the same costs to the council, albeit not in an in-house care home setting, but in an external care home setting. So the savings that we were making were quite modest in terms of the operating costs of the building. The biggest costs relate to the charges for those individuals, the staffing costs for those individuals, and that cost will continue in their external placements. So there won't be a significant impact in the figures.
So what about when the building's sold? What happens there then?
The sale of the building is called a capital receipt, and that can be used in certain ways. It doesn't come into adult social care for us to reinvest. It can be used to repay debt. It can be used to offset transformation pieces of work. But the revenue, which is the day-to-day running costs, we will save a small amount this year and more next. But the capital receipt is not adult social care's capital receipt. The building belongs to the council, not the directorate.
Thank you for that, Councillor Kidger. Okay, Councillor Hartbrook.
Thank you, Chair. And I'm aware that care is quite an emotive topic. It's interesting to see that care demand in the city is growing. A few questions. One, is that a trend that we think will increase, you know, with demographics and other pressures. And then secondly, in terms of provision of the care, is it more cost effective to the council to provide it in-house or to contract out? And if it's more cost effective to contract out, why is that?
So taking the first point around demographic, the budget is built every year, and I'm coming back to Anthony's point, is that we look at trend. That's the first point, which is why I concentrated on deaths and discharges. The trend was not being followed, so that's kind of caught us out a little bit. It's difficult to project the future, so we look at trends. We look at strategy in the directorate, so we've got Home First going through now. 5, 6, 7 years ago, we used strengths-based social work, so we had a plan that less people in residential care, more people at home. So we look at what the strategy is. But in terms of demography, which sometimes works and sometimes doesn't, we use ONS data. It's referenced as Poppy and Pansy. So we use that and we take the, I think it's the 85. You can take particular age groups to say it's going to grow by. I would say that the one that's most difficult is learning disability. Because what we tend to find is there are 2 entry points, which is people rising 18, but also people who live at home. And they may have a carer breakdown, or people get to an age where they can't look after the child. So there's sort of a 45, 55 hit and an 18 hit. So that's how we plan in terms of demography. In terms of care in-house or external, it's terrible to use this term, but more standard care, it is generally cheaper to commission than provide, and I'll explain why. Where it is more technical and more expertise, it tends to be the local authority is cheaper. One of the reasons why is, I suppose, our terms and conditions for staff are better than external. Our pay, our sick pay, our holidays. And it may well be, I can't talk for how the external sector works, but I know, where we have gaps, we fill those gaps rather than operate. It's really difficult for me to say that others operate unsafely because I have no knowledge. What I'm saying is that if we have gaps, we fill them rather than work short-handed. But I think the main reason, undoubtedly, is terms and conditions.
Super, thank you very much for that. So we're going to move seamlessly into item 10 now, which is the budget proposals. And I just wanted to set out a little bit of context before we enter that discussion. So obviously we, board members, had a private working group just before Christmas about this item. And but the papers, for anyone watching, are exactly the same. So we haven't had any sort of additional information. We just had a first look at that. Those comments that were made the first time round, those have been noted and they will be part of the wider discussion. But I do think it's worth also saying that one of the purposes of this part of the scrutiny project is that all the scrutiny boards will then have one paper that goes to exec board, which the exec board has to consider as part of its deliberations over the final proposals that then go to exec board and then go to full council for a vote. And I thought it was helpful just to give you an idea of where the 5 chairs have been getting to, just so you have an idea of the direction of travel, and that might help you frame any questions or think, oh, actually, where we're going in terms of where we're going to challenge exec board is good. So let me just go through them. So the first one is around seeking further assurance around the deliverability of the budget savings given the scale of the challenge. And I think that's the sort of question I was asking about in terms of can we manage that. And obviously the proposed savings are very, very significant and very challenging in a context where, if we're honest, we haven't met them this year as we would have liked to. I guess the next one would be around reflect on the financial sustainability of the council's reserves. And again, this is around getting through this year using reserves, so I think that's important. The third one is to emphasise that added value delivered by third sector partners, and importance of budget setting process recognising the consequential impact of services and citizens sort of all on a sort of diminishing grant funding. So again, that's really important, particularly in our health context, because we have a lot of third sector providers, and I'm sure you'll remember we talked about the neighbourhood networks, and my understanding is they are coming with a deputation to council tomorrow as well. So we're not the only person picking that one up, but it's important because I feel like that's one of the most relevant for us. Seek assurance about the national insurance challenges and the compensation we'll get as a council for that, because obviously that would have a massive impact for us as a council. To seek assurance about trade union engagement in relation to planned staff reductions, including via voluntary mechanisms. And then the last one on the list that is sort of cross scrutiny board is to seek assurance about the council's technical ability and capacity to build the business transformations which underpins many of the proposals, particularly given planned reductions to overtime and structural review of IDS. And I think we've known for a number of time a lot of the savings in the overall budget has been around business transformation, and so the IDS is important in that. That's probably less relevant to our particular scrutiny board, but I thought that's helpful just to let you know where they, like the 5 boards, were coming together. Caroline asked me what items to go through, and I guess given that we've gone through the presentation in the private members meeting, all the information is the pack, I'm not proposing that we go through all the proposals. What I'm going to propose is we go through questions and comments that you want to make, and if they're comments, that's fine. I don't think necessarily every comment needs sort of a formal answer from people around the table today, but it's important that we have the opportunity to comment in a public setting on particular items, so we know that the exec board need to consider those points. Just before we get into that, so if you want to comment, please indicate to me and I'll bring you in due course. I just wanted to ask John just to set out first something around the final settlement. So my understanding is that there's a provisional settlement in place at the moment and the final settlement isn't yet being given. My personal view is that's really hard for the council to set a budget on a provisional basis, and that's a real shame. Hopefully that will get better in future years. I really think that's important to say that. So just set that out, and then if you want to comment on anything on the proposed budget items in relation to this scrutiny board's proposals, let me know. That'd be helpful. Thank you.
Chair, just to confirm, I'm not party to that corporate role. My basis is in adults and health as a directorate. This particular provisional support funding is dealt with by Victoria Bradshaw's team, corporate finance. So we're awaiting what data that might provide. Yes, it is difficult on the wider point around projecting a budget, but by and large, we are able to identify the pressures across any directorate, across each of our directorates. We anticipate things like pay award. As a colleague asked, we anticipate what our demand will be. And basically we think, right, okay, that's what we think our pressures are going to be. If we assume all grants will continue, if we assume council tax will inflate by, you have a broad picture from which to operate, and it's that basis we do. And then when it comes in, again, Victoria and her colleagues will be far better versed than I. They will determine whether that gives us a little bit of flexibility or whether that means we have to tighten something up in the remaining months.
Great, thank you very much, John. Okay, I'm going to bring in Councillor Ritchie.
Yeah, Chair, I couldn't make the working group, but I did submit some points. Are you saying you don't want us to repeat them here in public?
So your specific questions, they haven't been discussed in detail, so you can ask those questions 100%.
Okay. The first one's a new one for today, and it's just reflecting on the figures again. There's some quite significant business as usual savings where we don't get presented with the specific details. I wonder if you could comment on that and the reason for that. I know we can't look at every single decision, but perhaps over a certain value, perhaps they should be considered for scrutiny. So that's the first thing. Oh.
I'll come in on there. So yes, we do service reviews in terms of any proposals that meet the statutory requirement for consultation, and the others we treat as business as usual, because they're within our authority to be able to progress. They're not a change in any policy. They don't impact significantly on our workforce, and more than anything, they're about doing more of what we already do. So you're absolutely right. We've got a considerable number of business as usual savings and efficiencies, and it's really around implementing and exercising processes that we already have. So there are things like the vacancy control factor, ensuring that we know from the point that somebody leaves a post and the point at which they are then that vacancy is filled, there's a period of 3 months, 6 months. We know we'll make a saving out of that in terms of staffing. For some posts, we'll have to use agency staff, but for other posts, particularly where they're not frontline staff, we can make that as a saving. So it doesn't require a service review. It's just basically within our ability and our gift to identify, and therefore we work out how much of that we can deliver in terms of savings. Another example would be charging people who receive care and support services. Our data tells us what services people are receiving. We have financial assessment data, so we know how much we can charge people, what charges we can levy, and therefore anticipate where we can make that sort of saving by generating those that income. Another example will be negotiations with our NHS, our health partners, around funding that we can receive from them, and just clarifying how we can maximise that, including for people who are jointly funded, working together with the NHS to really sort of lever in additional funding. So yes, we've got a huge number of business as usuals, but they are ones that we have a relative amount of confidence that we will be able to deliver during the course of the next financial year. I hope that actually answers the question.
I guess from my perspective, I guess maybe there's a question around whether we can get some more details on those in future years. So when you get several business as usuals that all add up to, I don't know how many million, I haven't added them up, that we get a bit more details of what that means. And I think there's also maybe a wider question for us as a board about whether we should be doing a piece of work around, for example, vacancy control and the impact that has on adult social care or whichever team or the whole team. So I think that's a comment rather than a question. So I'm going to pass back to Councillor Ritchie for his questions. Thank you.
Okay, thank you. So on page 233, the review of non-statutory grants, I just want to make the point that these are preventative services which could end up costing more by increasing demand in other sectors, and a reflection that the government's employers' national insurance increase is putting pressure on the sector as well. So I do feel that having such a valued and crucial third sector who've contributed over the years to our budget position, dealing with the cuts, they're at risk with this reduction. So I did make a suggestion that rather than this 10% across the board reduction, you might scrutinise each organisation investigate the financial robustness and ability to make service delivery, maintain service delivery, looking at surpluses and reserves. In terms of the 235 and the transformation of in-house day opportunities, again, just want to reflect that we may have difficulty with people accessing the new mental health hub facilities. So the proposal to shut Armley, which caters for West Leeds, not just Armley Ward. I think they'd be moving to the hubs in Horsforth. And I've been contacted by constituents around those concerns about accessing that. On the in-house care delivery service, the charges, again, I think that risks a loss of engagement and then potentially puts pressure on other acute services as a result, as well as the impact on the individual if they decide that they can't afford those charges. On a more positive note, I do support the principle around the prevention programme on page 239. I've got my old page numbers down here. I think that's 239. Yeah, the prevention programme, so I really welcome that, and yeah, fantastic. And then the final one I want to comment on is the review of passenger transport. And again, there's a risk that people will drop out of attending these services. They've got the triple whammy of cost of living, benefit cuts, and the charging reviews that are having an impact on some people. Again, these have been brought to my attention and are causing a real worry for people. So I know it's difficult, and you've got those proposals. We're here to just scrutinise and check that get reassurance measures are in place. Perhaps if there's flexibility to change any of those things. But yeah, I know it's easy for me to sit here and say, don't do this, don't do that, but I appreciate we have to set a balanced budget, otherwise the cuts that commissioners will undertake will be quite ruthless as far as our constituents and residents are concerned.
Thank you very much, Councillor Ritchie. I mean, I think I have to start by saying that this is really difficult because this isn't the first time we're doing this. We've had years and years of having to deliver efficiencies and savings, and of course you will appreciate that it just gets harder and harder, and therefore we've had to identify absolutely every area that perhaps we haven't touched before, or that we have touched before but we could perhaps go a bit further. We have looked at every single line of our spend, and John, I have to say, over the last few months has worked, you know, solidly on trying to help navigate where we might be able to deliver some of these savings. I think just taking some of the points in specifically that you've mentioned, in terms of the third sector reductions, we absolutely don't want to take a flat 10% reduction. We are talking to all of those organisations that would be impacted to look at what is the best way of delivering some of those savings, considering that we do want that sort of preventative offer to remain in our wonderful city. You know, I came to Leeds just over 7 years ago from another authority where we'd absolutely stopped funding any third sector provision, and it fills me with great pride that in Leeds we continue to invest in our neighbourhood networks and in other third sector organisations, because we know that they are the organisations that are helping prevent people's loneliness and health deteriorating. So it pains me greatly that we have to look at this, but we are still a good investor in our third sector, and this set of proposals is a small amount relative to what we invest, but absolutely take the point around looking at not having that very blanket approach, but taking a much more sort of considered approach, and you know, doing the least harm that we possibly can in terms of our investment with the third sector. In terms of the mental health hub closures, again, we are really mindful. We are speaking to absolutely every single individual that currently accesses those services to look at whether there's an opportunity for them to continue to access the support they need in their geographical area, not necessarily in a building, or in an alternative building that is already in that geographical area, so that they are not required to travel to a different part of the city. But what we have said right from the onset is that this is not about reducing the offer to those individuals, just where their support is delivered from. So I really want to stress that point. The two charging points, the in-house services and including the passenger transport charging, again, this is about trying to ensure that we've got a little bit of consistency in our approach, because currently we apply those charges to a great number of people, but there are some circumstances when we know we're not charging. So it's about making sure that we're consistent. We will obviously take into account people's ability to pay. We will also take into account that if people say, well, I'm going to have to stop accessing that service because I can't afford to pay for it, we need to consider the implications for those individuals, because we absolutely don't want them to then have their health deteriorate, their well-being deteriorate to the point which means that they then require more expensive care. And this includes our approach to people who are carers, and the fact that they're getting a bit of respite and a bit of relief from somebody accessing the care, somebody in their family accessing care. We consider the impact and implications for carers as well. So I just want to provide a little bit of assurance that none of this is blanket. We have discretion, and we'll deploy discretion based on an individual's ability to access and to fund any charges, pay for any charges. I'm grateful that you welcome that prevention programme. It is identifying a saving of £2 million. We think that there's a huge amount of opportunity there, and we know that because some other local authority areas have already embarked on that journey, and we can see where they've delivered some of those efficiencies. So we have a level of confidence that we'll be able to really sort of do better in our prevention offer at more sort of cost-effective means as well. I hope that answers the questions, Councillor Ritchie.
Yeah, it does, and I'm really grateful for your thorough responses. And as I said, I know you do this with a heavy heart and a reluctance, as much as we face setting that budget. I just want to reflect on your comments about the mental health hub facilities, and it is clear in the papers, that assurance that this isn't a cut to the service. But I just wanted to make the point that people are attracted to that building and the networks that they've built up there. So hopefully within that community there can still be signposted to other peer support groups, and perhaps build on some of the ABCD work that we've got going on in West Leeds and develop that as an alternative. But yeah, is that the love for the building, which was opened by the now Sir John Battle back when it was opened. But I do take the point as well about the condition of the building, the lack of investment, the fact that there are changing places, facilities in the hubs that you're retaining. So yeah, that's kind of it, but thank you.
Thank you very much. Okay, I'm going to bring in Councillor Blackburn next.
I just want to agree with Councillor Ritchie about both Stockhill and the 10% cut on discretionary expenditure. I think it's important that we don't do something as a council that we might regret in pulling services away that we then can't cover. I welcome the idea that you say that it's not going to be a cut across the board. You're going to talk with organisations, but it's important. And I've got to say that one of the organisations that covers my area, Armley Helping Hands, they did the COVID stuff in my ward, and the fact is, without them, I don't know what we'd have done. So if they're subject to having their staff cut, I mean, I don't know what happens if we have a major problem. But as I said, generally speaking, I don't require a reply from this because I think you've covered what Councillor Ritchie said. But I just want to show my support for what Councillor Ritchie said.
Thank you very much, Councillor Blackburn. Yes, I agree. That's a comment. That's a fair comment, but thank you for that. Okay, Jonathan, do you want to come in? I haven't seen anyone else indicating, so if you want to come in, do indicate. Thank you.
Thank you, Chair. It's an enormous and very difficult task that you're doing, and I just want to acknowledge how difficult it must be for you all. I wanted to raise an issue about communication, because one of the things I'm worried about is that some people will, when this all gets out and it becomes more real and it's been through exec, etc., some people in receiving some services are likely to panic that their services are going to vanish. There'll be rumours around and misinformation. And it might be a question more for exec to consider than this scrutiny panel, but is it possible to develop like a person-centred approach to communication in relation to this, so it's not all about talking about the money going, but talking about the impact and how that impact is being mitigated in various sorts of ways, so that somehow it's possible to take to where there are positive stories, make sure those come out, and make sure that people don't make bad decisions about their lives and their care because they think it's actually going to be worse than it is. So I'm not quite sure where that goes, but it's just a worry that I've got about it.
Thank you, Jonathan. I saw Councillor Arif indicate, so she's an exec member, so maybe she can comment on your point as well, Jonathan. Thank you.
Yeah, I think that's a really important point, Jonathan, in terms of communication, and I've had reassurances from officers that in terms of communicating this, the impact, that will be certainly considered. And I think perhaps further thought ought to be given to that, just to make sure, I guess at this point they are proposals, the budget will be set in February. But I think that's a really important point. Just reflecting on the conversation, it's been acknowledged by John, by Caroline, by members and yourself, Chair, how very difficult this has been. These are really unprecedented financial pressures. The task is mammoth. We've had to find savings of multi-millions of pounds just within this service. And that means everything needs to be looked at, be it services we deliver in-house or services we commission outside to third sectors. And I've done the tour around the neighbourhood networks. Armley Helping Hand, as Councillor Blackburn has said, did a phenomenal amount of work during the COVID pandemic and continue to do brilliant work. I joined their line dancing a few months back, probably last year actually. But the point I'm trying to make is, I guess, a commitment from my perspective as a cabinet member in terms of our neighbourhood networks. They are incredibly valued and we take pride in our neighbourhood networks, and that's the reason why we actually, when we came to do our contracts, it was a 5-year contract, and we then additionally added the 2 years just to give them that reassurance. It is a proposal in this moment in time. There is going to be feedback that we will look at very carefully and consider everything, but completely appreciate the feelings and the sentiments around the table. And just to reiterate from my end, the neighbourhood networks are our pride, and we'll do all we can to work with them, and we continue to do so. And I want to thank the members for your involvement as well. All the members I know that are involved in their local neighbourhood networks, that makes a real difference. But it is a really, really difficult task. There will be impacts on people, and I guess what we're going to do as a service is to ensure that impact is minimised as best as we can. But there will be good coming out of this as well in terms of amalgamating some services that might have better, we can provide better services. So just wanted to reflect and comment on that. Thanks, Chair.
Super, thanks for that, Councillor Arif, that's helpful. Okay, so just going to come to the close of this item. I just think it's worth one other comment from me, which is just to encourage you to be cognizant of the system-wide implications of the decisions made. And obviously, as a system, we all work together, whether that's the third sector or the NHS or the council services, and it has to be a collaborative system. Otherwise, if we're all watching out for ourselves mostly, everyone will lose out. It's a collective system problem, just as many are. So with that, thank you very much for attending. I think that's really helpful. We're going to move on to the work item, and just remind members that we actually have a little presentation from Caroline on this item because of the Care Quality Commission. So other people who are guests, you're welcome to leave, you're welcome to stay. And I'm going to just hand over to Caroline. You've got some slides which Angela's going to bring up. And you can just set out the context of what's happening and when it's due. Thank you very much.
Thank you very much. Yes, in terms of CQC assurance, I think we did bring a report previously around our preparations and readiness, becoming ready for CQC when they do come and start their assurance process. Well, on the 16th of December, a Monday morning, a very cold Monday morning, we received notification from CQC that they were going to start their process in Leeds. Notice to submit a whole set of documentation, information returns, 38 different information returns, which they needed, which we were required to submit to them. Normally they give 3 weeks for all local authorities to submit all of that information, including then a self-assessment. But because this fell over the Christmas period, they very generously gave us an extra week. So we had 4 weeks to pull together all of our information and submit and return it by Friday the 10th of January, which was last Friday. I'm really pleased to say that we absolutely hit that deadline. So the point of coming here today was just to give you a little bit of an update as to where we are as a result of the situation we found ourselves in from the 16th of December. So just a very quick reminder, there's now a statutory duty for the Care Quality Commission to come and inspect our performance around our adult social care services and our compliance with meeting the Care Act 2014. And the whole process started in December 2023, and the CQC had a 2-year period by which they needed to undertake their assessments of 153 local authorities that have adult social care within their remit. As I say, we received notification on the 16th of December. Next slide, please. So we've completed the information return. I have to say that it's in excess of 300 documents of evidence that we have submitted, demonstrating the information that they've requested, demonstrating where we, as evidence of where we're complying. And we've also submitted a sort of 50-page self-assessment. The self-assessment identifies where we think we're doing well, those areas that we think we're particularly strong on, but equally identifying those areas where we think we've got work to do to improve. So it's about showing a self-awareness that by all means we haven't cracked everything, and that we're on a journey with certain things in terms of development. And we've talked previously about direct payments, for example. That's one area that we have identified that we are on a journey, we are on an improvement programme, and we are working to deliver on that. So we've submitted meeting our deadline. Now we have to wait a little bit in terms of CQCs will notify us of when they want to do the next phase, which is the site visit. The site visit takes place over 3 or 4 days,
where a team of inspectors, up to 10, maybe even 12 inspectors, will come and see us. Before they come and see us, they'll do an online call with our directorate leadership team, just for us to say to them, it's a 3.5 hour opportunity for us to explain where we think we're doing well, where we think we've got work to do, and our programmes of work and our evidence, so we can present that as a directorate leadership team over that 3.5 hour slot. And then they come and they do undertake focused discussions with our frontline staff. They want to see and meet with our exec member, our cabinet member, the shadow cabinet member, and yourself as well, Councillor Scopes, as the chair of the Scrutiny Committee. And they also want to talk to partners, they want to talk to our third sector representatives, and also our care and support providers. So all of that would be scheduled, and that's why we have that 6 to 8 week notice to get all of that in line. However, what we also know is that that could take place any time between now and June, and that timescale could slip as well. So we could be waiting for quite a significant period of time before they say, right, okay, we will be with you on site in the next 6 to 8 weeks. However, we're not sitting here now doing nothing. There's a whole load of work that we are instigating whilst we wait for information around them coming and doing the site visit. So the next slide will encompass some of that. So we've still got the steering group. I still chair that. That still meets fortnightly. We also have a DLT conversation every week around our readiness. In addition to that, there are quite significant offers of support around being ready. That includes from the regional Yorkshire and Humber ADAS group, the Local Government Association and Partners in Care and Health are also offering support to all local authorities that had their notification to say, we will come and we will talk to your elected members, your relevant elected members, that is, your staff groups, your principal social worker, your principal occupational therapist, just to sort of make sure that they are interview ready, as it were, so that they don't feel nervous and that they feel that they can give an honest appraisal of where they think we are as a council. We also have a network which is it says the performance network, so that is Rob Wood and sort of data intelligence, just basically around, you know, are we confident in the accuracy of our reporting of our data? Because of course they will use the data to triangulate where they think we are doing well or where they think we've got areas that we want to improve. And the whole focus for them is around honesty, around, okay, are we self-aware, and do we know what our frontline staff are thinking, what our partners are thinking about us, where they think we've got room for improvement? Are we aware of that, and are we doing something about it? So it's about making sure that we're as honest and open and transparent as we possibly can be, recognising that nobody really is going to be sort of 100% perfect on board on every single aspect of their duties and responsibilities. We also have a principal social worker network which shares sort of, you know, information and intelligence. We're learning also from those authorities that have already undergone their CQC assurance. We're reading the reports that have been produced by CQC on people's experiences. So again, it's all of that is used to aid us in our preparation. We are also going to partnership leadership team across health and social care. We're meeting with our care and support providers at our strategic provider forum and constantly updating people around where we think we are, where we think we're doing well, and where we think we've got work to do. And more than anything, providing assurance that where we know we've got work to do, that we're on it, we're on the case, and we're working on it and we're developing. So next slide, please. So that preparatory work is happening as of Friday. We're now at that point where we're just making sure that we've got everything lined up and that we're in the best possible place to be presenting our case when CQC arrive. We've got to do, I mentioned the presentation, we'll have a 3.5 hour slot where we have to talk about our presentation, but we have to be mindful, we don't want to bore them to tears, we have to be succinct and we have to be really focused. So it's a bit of an art and it's getting ready for that. We will do some dry runs with our Yorkshire and Humber colleagues and with partners in care and health as well, so that we're in the best possible place. And then the next slide, I think this is the last slide. This outlines the various offers of support that Partners in Care and Health, the Local Government Association, are providing to us. And we're in that process now. Indeed, we had a call yesterday with our Local Government Association and our peer colleagues around the sort of support we would like and when we would like it. And we are talking about and identifying sort of March as a really good time, because that will take account of people taking what leave they've got left this year, and it will take account of, we've got March is Ramadan month and we really want, you know, people to enjoy that time off. We know we've got plenty of time because we will from sort of the end of March onwards, we will have Partners in Care and Health and the Yorkshire and Humber ADAS region support directed to us, so that we're early enough that we can do some of the dry runs, we can hear what our staff are saying, we can get the feedback around where we might need to do a little bit more focused work, and then we'll have the time from sort of April, May to do any more preparatory work where we identify that there might be some shortfalls or some gaps, because we really don't think that they will arrive much sooner than sort of May time, to be quite honest. So that's pretty much where we are in terms of our readiness. So I just thought it was really important to update you on the progress so far. Happy to take any questions.
Great, thank you for that. If you've got a question, please indicate. Just my take on the presentation, I think if you want to keep interest, storytelling is a good strategy. So maybe a story of someone who's experienced. I can't see anyone indicating, so we'll take that as really useful information. I wanted the board to be aware of what's going on and not have sort of a different level of information to you as the board. So I think that's really helpful. So in terms of the rest of the work schedule item, are there any comments about the work schedule for the next 2 meetings? No? Great. So with that, thank you very much for coming. I think it's been a useful meeting. I appreciate everyone's time and comments and contributions, and look forward to seeing you all in February. Have a nice evening.